What we've noticed in our institution is that patients who are more obese have more challenging disease course in immune thrombocytopenic purpura. So we decided to look retrospectively at our patients with ITP, and we excluded all patients with secondary ITP or with ITP that's associated with autoimmune serologies, just to make sure that we actually focus exclusively on the primary ITP. We also excluded all of the potential confounding variables such as bone marrow conditions and other hematologic disorders. And then we stratified the patients in 4 groups based on their body mass index, regular weight, obese, morbidly obese. And then we looked at the ITP-related outcomes in those patients. And what we saw that the patients with ITP had tended to have much lower platelet counts, both at diagnosis as well as nadir platelet counts, and therefore were much more likely to require therapy for their condition. And when they were treated with steroids, their duration of remission was much shorter, which was all statistically significant. We also saw that they required more lines of therapy. So our conclusions were that patients with obesity have worse disease course in ITP, and perhaps addressing the obesity would be a useful clinical measure and clinical intervention for those patients.